A pleasant evening, ladies and gentlemen. There is so much happening right now in this COVID-19 crisis. And here on the Wayne Hall Show, we always like to highlight the silver lining behind this dark COVID cloud. And we have a true silver lining to share with you on the Wayne Hall Show right now because I have with me Miss ShelliAnn Mckenzie. And Miss ShelliAnn Mckenzie is a registered nurse and local community leader in both Gwinnett and Barrow counties here in Georgia. ShelliAnn has dedicated the last 22 years of her career to healthcare. Her nursing journey began in New York prior to her relocation to Georgia. And she has a proven record of performance. She holds a bachelor's degree in nursing and a master's degree in nursing administration with informatics, both from Malloy College in New York. ShelliAnn, it's my pleasure to have you on the show. Welcome.
Hi, Wayne. How are you?
I am doing good, man. I'm doing good. And listen, I'm very inspired by what I'm learning about you. Very inspired. And COVID-19 is such a sore point in so many ways, but boy, do we have some real silver linings, and I gotta admit you're one of them. So what I want to do, ShelliAnn, is I just gave a little bit about your background, but why the passion for nursing? I'm curious.
The passion for nursing, well, most would know that you say, well, you wanted to help people, or you wanted to make an impact in somebody's life by just showing care and compassion,
Right.
And just being able to empathize with people and help them when they're not at their best. So that was when I began 22 years ago.
Okay, amazing indeed, and you truly are passionate about what you do. Here you are, you relocated to Georgia, and in looking at your bio, you point out that you're no longer a frontline hero, but like I like to say, everybody in the healthcare field right now is a hero, whether they're the ones out there putting on injecting that patient or doing the hands-on. So kudos to you. Why don't you share how this COVID journey has impacted your career as a nurse? Even though you are considering yourself behind the scene, I'm seeing where you have even formed a group. You're doing all you can to help in the community in terms of personal protective equipment. Why don't you just share that with us in your own words, how this COVID experience has shaped your contribution as a healthcare professional?
Well, I would say about 5 weeks ago, I had a few things happen. I had one of my close colleagues, she was diagnosed. I had 3 family members diagnosed. I lost 2 of them. And I've been in administration and informatics. Informatics is the healthcare IT side of things, just to put it, pretty plain for those to understand. So healthcare informatics is the area that I've worked in. It is a nursing specialty, but it took me away from the bedside, but I'm able to impact patients through the use of technology and use technology mediums for electronic health records. So that's the area I was working in. I'm also a project manager. I do some community work as my give back, and I host health and wellness events for the community. So when I saw what was happening and I heard the cries from the front line with the lack of PPE, I thought about how I could help with my coordination skills and my relationships in the community. And I thought of how I could start to mobilize the members of our community to start helping out their local frontline workers. And that also includes not only healthcare professionals, but first responders. So I was prompted by every day I watch the news and I would see literally people crying, people dying, people getting diagnosed. And I do hold a compact license, so I'm still a licensed registered nurse, and I can nurse in multiple states. And as I got the calls, I said, how can I best utilize my skills and my expertise? And I thought of just moving forward with trying to mobilize the community to start sewing masks and do everything that we can to help provide the PPE to the front line. Masks, gowns, bleach wipes. I'm just trying to figure out how to coordinate those efforts and form partnerships to get the front line what they needed. So that was when the birth of Help for Healthcare Professionals, Inc. That's where it started on April 1st.
Okay, so you began this group, Help for Healthcare Professionals, Inc., in order, which is a non-profit organization, in order to support the front line, so to speak. So what have you been able to do as a result of forming HHCP?
Well, our primary mission is to mobilize people and resources and reciprocate care for the healthcare professionals that vowed to take care of us, right? So just to support them in any way that they can. So what we've done is we have a group of less than 40 individuals. So they're sewing masks and now gowns to get that to the healthcare professionals. We've sewn over 2,700 masks in maybe about 4 weeks. So we've sewn 2,700 masks. And again, our group is small in comparison to some of the larger groups out there. So what I say is, okay, 2,700 masks we've hand sewn, but what if we had 50 or 100 people helping us, right? So these volunteers have done a remarkable job. It's 100% volunteer network we're running right now. And I'm still just so amazed at the volunteers. We're all strangers, right? So for them to be able to step up and dedicate their time, they have families. I know they're exhausted, but for them to do that for this cause is awesome. We started providing frontline meals as well. So we feed different departments, or we match a sponsor, a frontline meal sponsor, with a particular restaurant in a local community, and we provide meals. So far we've done 720 meals, and we catered for Easter Sunday at one of the local hospitals and so forth. So masks, gowns, frontline meals, and right now we're moving into care packages for individuals as well as the frontline or first responder immediate families. So that's what we're trying to do.
How are you able to distribute this many? I mean, that's, to me, that's a lot of protective equipment there. How are you able to distribute that?
Well, it started with me collecting the actual PPE from local neighbors. So I have a pickup. So I drove around, because it got to the point where in Georgia, everyone was supposed to shelter in place. So I drove around at the pickup. I was able to stay safe. They were able to put their equipment in the back of the pickup. I clean them and get them distributed to the hospitals. And then now I attribute my success. I have team managers. So I have a frontline meal team manager. Her name is LaShawna Turner, and she's the owner of my hair salon. But her salon was closed, so she stepped up to help. My mask manager, her name is Yvonne Pillard. We call her Vonnie, and she's coordinating about 40 or so seamstresses, our cutters, our sewers, and everything. And she owns Immaculate Carpet. So she cleans carpets. Her business was closed. LaShawna does hair. Her salon was closed. So they stepped up to help. Our nail salons, the owner of Noiri Nail Salon and some other local businesses, they began to help us sew. And anywhere from each individual on our sewing team has sewn anywhere from 25 masks, sometimes a one-time drop, 25 masks, to some that have sewn 315 masks individually. So we're still amazed at the work that they've been able to do.
Awesome stuff. Ladies and gentlemen, we're speaking with Miss ShelliAnn Mckenzie, a registered nurse and local community leader in both Gwinnett and Barrow counties here in Georgia, doing a lot of amazing things behind the scene to support her frontline colleagues, and forming the HHCP, Help for Healthcare Professionals, Inc. And by so doing, a nonprofit organization has been able to mobilize her own community and family and friends into being part of this movement. How can we support HHCP? How can we in any way contribute to what you're doing if we wanted to?
Well, right now we're still accepting actual PPE donations. So individuals and businesses are urged to join our cause. You can you can make monetary donations on our website, which is hhcpinc.org. So that's HHCPinc.org. So we are accepting monetary donations. And if you know how to sew, if you don't know how to sew, we're even doing, we have one of our schools, Gwinnett County Public Schools, they actually are running a print shop where they're doing, how could I forget, 3D, they're doing ear guards and they're doing mask shields for us. So we've been able to supply those as well, because the elastic on the ears of these masks that the nurses and the doctors and healthcare professionals are having to wear, those are wreaking havoc on their ears. So we have ear guards. You put it at the back and then the mask sits across it. So if you have a 3D printer, we have something that if you have a skill, we can put it to use. We need help with planning. Again, we're running 100% volunteer operation. So just look at it like, okay, who takes care of the front line if they need help? What happens if there is no front line, right? Who do you call in case of an emergency? So it is our responsibility as a community to give back and help the healthcare professionals that have vowed to take care of us no matter what. They're out there sacrificing every day. They're being resilient. And, you know, they're getting sick. In Georgia right now, 10% of the positive coronavirus cases are healthcare professionals. Right now, today, I just checked the numbers, we're over 28,000 in Georgia. That might be a lower number than some of the other states that have been plagued with this disease, but 10% of that being healthcare workers right now, that's what, 2,800 healthcare professionals.
That's close to
most of which are women. Yeah, most of which are women or African Americans. So there's more investigation to be done because the numbers are not really reflective of how many are actually dying. So if the limited data that's available shows that 10% are infected, right? What do the true numbers look like if they started to add in the number of deaths and so forth among the healthcare workers? So yeah, there's quite a lot of work to be done. So we take monetary donations as well as PPE donations to support our efforts of the gown sewing. We take fabric donations as well. We have some companies sending us 100 KN95 masks, or we have people sending us batches of bleach supply wipes. And we just doing what we can in our neck of the woods. And we support a 30-mile radius of the CULA, which includes 19 counties. So we haven't gotten to all 19 yet, but our goal and in our strategic plan, we're able to support within the 30-mile radius of where I sit in Decula, Georgia.
ShelliAnn Mckenzie, ladies and gentlemen, registered nurse, doing her best to support her frontline colleagues in a very touching story here on the Wayne Hall Show. ShelliAnn, you've not just been active since COVID-19. You know, just like your career, which started long before COVID-19, you're also a co-founder of the Black Women Leader in Nursing, Inc. Yeah. And I know about an event that COVID affected, by the way, that you were putting on and doing some work with nurses, you know, trying to assist nurses back home in Jamaica. Tell us about the organization and also how we can support that one as well.
Okay, all right. Well, Black Women Leaders in Nursing is our other nonprofit organization. And with that, what our goal is to reach out and help upcoming nurses or other nurses that plan to advance their careers and just find individual growth opportunities in nursing leadership positions. So our goal is to mentor and just help them navigate the path. We do that by highlighting their accomplishments and the work that they're doing, and just forming a strong support network. Right now, we have a network of over 2,300 nurses. You can follow us on Instagram, Twitter, and other social media platforms. We were doing the bottle drive, which came to almost a halt because of this COVID-19, which started within a month of the launch of that bottle drive. But we have a strong partnership with the Nurses Association of Jamaica, and we've been in communication with them, and we will follow communications once all of this is done, and be able to provide those scholarships for the nurses in Jamaica that we did promise. So we will definitely follow through on that. But you can find Black Women Leaders in Nursing. All you have to do is Google us, and you'll find us, and we do accept donations to carry on our work. And we have a gala coming up at the end of the year for Black women leaders in nursing. And we're just focusing on our mentorship program and finding the for the nurses that need support, and matching them with those nurse leaders that are able to give back.
That's right. Shelli-Ann Mckenzie, ladies and gentlemen, just sharing her wonderful, wonderful contribution to our community. Shelli-Ann, I applaud you, and kudos for your commitment. I have seen you in the community do your thing, and very, very much trying to steer your community in the direction of better health. COVID-19, you took this lemon and made some good lemonade with it, and I appreciate that. Now, here's one thing. I hate to put you on the spot, but also having known a little more about you than we're talking about today,
Okay.
I know COVID-19 hit close to home as far as their family is concerned and relatives. Do you care to share a little of that? Because I do believe you've had a loss or two due to COVID-19.
Or 6.
Oh my goodness.
Okay, so the week leading up to me taking action, like I mentioned before, I had one very dear friend, pretty much like a sister. She was diagnosed, and then the week following that, I had an aunt in England, and within 24 hours, she was gone. And the day after that, my grandmother, who was never sick, she got diagnosed, and she was gone within 48 hours. And I had quite a number of deaths since that, close family, friends, I mean, in our immediate circle, immediate network. You know, I'm Jamaican, so everybody's uncle and auntie and everybody that's helped raise you along the way.
Yes.
Those people, they're family. And I had quite a number of them go because of COVID, and some not because of COVID, but we're still just hanging in there and staying strong. And, you know, our faith just keeps us going, and we just have to take it one day at a time. But it has been a struggle. It has been challenging. And 3 days later, after all of this started happening, I just woke up and I was like, you know what? With all the work I'm doing in the community and the services that we try to provide for the community, and the relationships that I've built over the years in North Georgia, I said it made absolute sense to move forward with something like this nonprofit organization. And it's not something that just erected because of COVID-19. There's so many issues in the community. Social determinants of health are impacting not only the members of the community, but there's so many factors that play into how healthcare workers do their job, follow through, and everything impacts the other, right? So there are different aspects. So it made sense.
Wow. Well, I applaud your strength. Our condolences, man. And do you think that your resolve was strengthened by those losses, knowing so many people affected?
Well, definitely. Again, I think it's more, I liken it unto a survivor's remorse. When I was at the bedside, I was extremely active. I was in nursing leadership roles in different specialty areas. And I was a very active nurse leader when I was at the bedside or on the front line. And it took everything out of me not to get on a plane and go back to New York.
Oh my goodness. Well, good. Again, ladies and gentlemen, great conversation today with Miss Shelli-Ann Mckenzie, registered nurse and local community leader in Gwinnett and Barrow counties here in Georgia. You've shared so much. Ladies and gentlemen, please check out the information she shared with us. Go to hhcpinc.org, and we can also telephone 678-948-5173 and find out how you can assist this wonderful movement that she's launched from behind the scenes of the front lines as a nurse and as a healthcare worker. Before we wrap this up, Shelli-Ann, anything else you would like to share with us?
Well, just want to encourage everyone to stay safe, be safe, stay inside as much as you can, you know, wash your hands and all of the recommendations that were given, not because your state may be open, you don't have to go outside. So just take the necessary precautions to keep yourself safe. And remember that we are in this together, and there's support if you need it. And you can always call on someone. And also remember to check in with your loved ones, check in with your family members, your colleagues, your friends, because some people are not doing okay.
That is so true. You know, this month is what? I think the
Mental
month
health
of May is Mental Health Month.
awareness month.
And
Yes, sir.
yeah, Mental Health Awareness Month. And what a setup COVID-19 has done, because we so often focus on the physical aspect of the impact of COVID on patients. But my goodness, it is really doing a lot to the mindset of those who are struck down, losing our jobs, having to stay home, not being able to go out like we used to socialize, all that stuff. It's truly taking a mental toll. And I'm glad we can be aware of that and be respectful and mindful of everyone during this time. Ms. Shelli-Ann Mckenzie, thank you so much for sharing this very, very invaluable information with the Wayne Hall Show. Again, we appreciate you. We thank you. We applaud you and encourage you to keep on keeping on.
Thanks, Wayne. Appreciate your time.
Have a good one.
All right, you too.